What is COVID-19? COVID-19 evolved from the coronavirus pathogen called severe acute respiratory syndrome. This virus comes from a large family of zoonotic coronaviruses, meaning the virus has the ability to transmit from animals to humans. The virus first emerged in Wuhan, China in December 2019. Researchers believe the virus originated in bats and transmitted the virus to other live animals in Wuhan's live animal market. The virus was then able to spread to humans. This virus strain's most notable symptoms infect the respiratory system, which may be dry cough, fever, shortness of breath, or further breathing difficulties. These symptoms may appear 2 to 14 days after exposure, and in more extreme cases can lead to pneumonia, organ failure, or kidney failure, and death. Who is most likely to be affected? People over 60 years of age, have cancer, hypertension, lung disease, diabetes, heart disease, or a compromised immune system. But why? Those who are immunocompromised or have a naturally weakened immune system as a result of aging have a harder time fighting off and recovering from strong infections. How it spreads. The virus spreads when germs from someone infected transmit onto a healthy person's eyes, nose, or mouth. Those germs may come from anywhere exposed to the virus that you may not realize. There is no vaccine yet, so how can you prevent or protect yourself from COVID-19? Here are some precautions. Number 1. Do not touch your face or anyone else's face. Number 2. Throw away your mask after using them for 1 day. Number 3. Do not share utensils. Number 4. Try to resist opening and closing doors with your hands. And number 5. Always wash your hands with soap thoroughly for at least 20 seconds. If you are around someone who is coughing or sneezing, choose to stand 6 feet from them. That and a filtered face mask will keep you safe from those germs. Because there is no vaccine, the virus is treated with rest, fluids, fever control, vital organ support by ventilator, and self-quarantine. The United States has over 1.1 million confirmed cases, over 64,000 deaths, and 136,000 patients recovered. The world has over 3.28 million confirmed cases, 234,000 deaths, and 1.02 million recovered. How has this pandemic impacted healthy families? Much of the population has resorted to quarantine life. This is how COVID-19 impacted my family. Now my family has limited grocery store runs. No social gatherings. No sports. We cannot eat food at restaurants. We can only order takeout or make food at home. All the kids have online school. No travel. We only get out of the house for Starbucks. My mom said the transition's been difficult. The kids only get out of the house 1 or 2 days every week. Whether or not this virus has impacted someone in some way, it is always good to understand it and hopefully keep yourself safe from it. Thanks for watching.